Have you ever heard of a silent killer? Since there are typically no symptoms associated with high blood pressure, doctors typically refer to it as a medical condition. Therefore, even if you might not be aware of it, your body is still suffering harm. One common condition that affects the body's arteries is high blood pressure. Another name for it is hypertension. The blood's constant excessive force against the arterial walls is a sign of high blood pressure. To pump blood, the heart has to work harder. Millimeters of mercury are used to measure blood pressure. A blood pressure measurement of 130/80 millimeters of mercury or greater is generally considered hypertension. Can you imagine the number of people who have hypertension? Don't be shocked by numbers. There are regional and national income disparities in the prevalence of hypertension. The WHO region of the Americas has the lowest prevalence of hypertension, 18%, whereas the WHO African region has the highest prevalence, 27% of hypertension. From 594 million in 1975 to 1.13 billion in 2015, there were adults with hypertension worldwide. Low and middle-income nations accounted for the majority of this rise. This growth is primarily the result of those populations' rising risk factors for hypertension. Blood pressure is categorized into four broad groups by the American Heart Association and the American College of Cardiology. Normal blood pressure falls into this category. Normal blood pressure. There is less than 120/80 millimeters of mercury of blood pressure. Increased BP. The bottom number is below, not over, 80 millimeters of mercury, and the top number varies from 120 to 129 millimeters of mercury. Hypertension in stage 1. The lower value is between 80 and 89 millimeters of mercury, and the upper number is between 130 and 139 millimeters of mercury. Hypertension in stage 2. 90 millimeters of mercury or more is the bottom number, while 140 millimeters of mercury or more is the top number. When the blood pressure reading is more than 180/120 millimeters of mercury, it is regarded as a hypertensive crisis or emergency. In the event that someone has these blood pressure values, get emergency medical attention. High blood pressure raises the risk of heart attack, stroke, and other major health issues if left untreated. Beginning at age 18, it's critical to have your blood pressure monitored at least every 2 years. Some people require checks more frequently. A good diet, exercise, and quitting smoking are examples of healthy lifestyle choices that can both prevent and treat high blood pressure. Some people's high blood pressure needs medication. Because of these complications, we will discuss the symptoms and causes of high blood pressure. So, let's get started. Did you know before that the silent killer may be a result and not the main accused behind the symptoms? First, we should know that hypertension could be primary as a direct cause of some condition or secondary as a result of another disease. The amount of blood your heart pumps and the resistance to blood flow via your arteries determine your blood pressure. Your blood pressure might be affected by conditions like dehydration or small arteries that affect either of these components. There could be multiple factors contributing to elevated blood pressure. Your doctor will diagnose you with primary, essential, or secondary hypertension, depending on what is causing your high blood pressure. One or both of these kinds are possible. Essential high blood pressure. Primary or essential hypertension is the term used to describe high blood pressure when there is no clear cause for it. This kind of hypertension affects 19 out of every 20 people with high blood pressure in the United States. It frequently takes many years to mature. Certain dietary and lifestyle factors have been associated with an increased risk of essential hypertension. Consuming excessive amounts of salt, for instance, might raise blood pressure. Due to the sensitivity of many people with this illness to salt, even a modest amount of food can elevate your blood pressure, known as a spike. The following other risk factors may further increase the possibility of developing essential hypertension. Not exercising enough, excessive consumption of alcohol, having a high blood pressure family member, growing older, particularly after the age of 65, being overweight, diabetes, stress, inadequate consumption of magnesium, calcium, and potassium, absence of exercise, long-term alcohol intake, secondary hypertension. Here, we can define this type of hypertension as a condition when a direct cause of high blood pressure is found. This particular form of hypertension is brought on by an unrelated medical problem. When compared to essential hypertension, it is typically more abrupt and severe. Among the causes are kidney disease. This is the most common cause of secondary hypertension, and it ranks highest on the list. because the kidney is the organ in charge of regulating water balance, which directly influences blood pressure. Adrenal disorders, tumors, or other anomalies of the adrenal glands, which are tiny structures that sit atop the kidneys, can also cause hypertension. They can release too much of the hormones that raise blood pressure due to adrenal tumors or diseases. Thyroid disorders. Blood pressure can be impacted by thyroid hormone levels, either too high or too low. Being pregnant. During pregnancy, hypertension can occasionally develop or worsen overnight. Preeclampsia is the name for hypertension that appears after 20 weeks of pregnancy. Obstructive sleep apnea. This illness results in oxygen deficiency and respiratory difficulties. This may cause artery damage. Congenital heart defects. Certain individuals have birth malformations of the heart as they were born with heart or blood vascular issues. Birth control tablets. Pregnancy and birth control pills, especially those that include estrogen, might raise blood pressure. Cold, painkillers, and cough syrups. These may cause a brief increase in blood pressure. Certain drugs, certain medications can narrow blood vessels, which makes the heart work harder to pump blood. Illegal medications, amphetamines and cocaine both increase blood pressure. Before we continue, if you're enjoying this video, don't forget to hit that like button and subscribe to the channel. It really helps us and lets us know what kind of content you want to see more of. As you are aware of the causes, let's move on to the symptoms, which you should be aware of. Remember that it is a silent killer, so be careful and pay attention to your body. The majority of hypertensive individuals experience no symptoms. In addition to other symptoms, extremely high blood pressure can induce headaches, impaired vision, and chest pain. The easiest way to determine whether you have high blood pressure is to take your blood pressure. Untreated hypertension raises the risk of developing heart disease, stroke, and kidney damage, among other illnesses. Symptoms of extremely high blood pressure, which is often 180/120 or greater, can include terrible headaches, chest discomfort, feeling dizzy, breathing difficulties, nausea, vomiting, blurry eyesight, or other abnormalities in vision, anxiety, disorientation, ear ringing, nose bleeding, irregular heartbeat. Seek medical attention right away if you have high blood pressure along with any of these symptoms. These symptoms aren't particular though. Usually they don't show up until high blood pressure gets to the point where it's dangerous or life-threatening. Remember that ignoring these symptoms can result in further issues because high blood pressure can seriously harm the heart. Overly increased pressure can cause artery hardening, which reduces the heart's ability to receive oxygen-rich blood. Having your blood pressure measured by a physician is the only way to identify hypertension. Measuring blood pressure is a simple and painless procedure. Even though anyone can use automated devices to check their own blood pressure, a medical professional's assessment is crucial for determining risk and related problems. High blood pressure has a wide range of causes. You have no control over certain risk variables, such as your age and family history. On the other hand, several healthful practices, such as eating a diet low in salt and exercising frequently, can help decrease blood pressure. Discuss blood pressure management strategies and the potential benefits of medication with your physician. Screening for blood pressure is a crucial component of general health care. Your age and general health will determine how frequently you should have your blood pressure tested. Beginning at age 18, get a blood pressure check from your physician at least every 2 years. Get your blood pressure checked annually if you are 40 years of age or older, or if you are 18 to 39 years old and at high risk of high blood pressure. Share with us your experiences and opinions in the comments below. Thanks for watching.